Hello, this is Dr. Gay from First Look MRI, and this is a short video to talk about an AC injury, the acromioclavicular joint. It's a really common injury, and everybody's either had or had a friend who's had an AC sprain or AC ligament injury. So this is a patient who has a normal appearing clavicle here. This is the acromion process. This is the AC joint. So this is a normal AC joint on the left side. See how nice and closely approximated things are? Well, they fell recently, and their right shoulder is the one having pain, and we can see the difference. We see the clavicle is not fractured. It comes across here and ends, but rather than down here next to the acromion process, the clavicle is elevated. So we know that the ligaments that hold this together are torn. And there's some other ligaments that come off this process. This is called the coracoid, and they go up here as well. So ligaments hold it here, and ligaments hold it here. And so sometimes the surgeon will want to have an MRI scan before they do surgery, just to see where they're at or plan some procedure. And so this is an MRI we have to look at this from an MRI perspective. So on MRI, we see not just the bones, but we also see the soft tissues. So this is a view here. We're looking at the humeral head. This is the cup it sits in here called the glenoid. And that clavicle is right here. You can see the bones are not as well seen on as on X-ray. We can really see them well. They look a little funny here because you don't see them all in one picture. You have to rotate through the pictures to see components. But this is the distal clavicle. We're going to follow it across. It ends right here. And then this is the acromion down here. So this is that separation we saw. Normally when it sits down here, we see black ligaments that come across from here to here, really dark bands, and they hold this joint tight together. But these ligaments are completely ruptured. Instead of being nice and jet black, they're really bright and foggy. So the AC ligaments are completely torn, and the clavicle is elevated. Now there's another set of ligaments we talked about earlier that are torn. This is the coracoid process, and there's a band of ligaments that come up here, and one here, and these will keep the clavicle down as well. So when these are torn and this one is torn, the clavicle can drift upwards just like this, and we see this bright stuff fluid around here. This is hemorrhage and edema all surrounding this. So imagine if this one here in the coracoid process, here to here, these coracoclavicular ligaments were intact, then the clavicle would be down in roughly normal position, maybe a little bit of separation. But since these ones are completely torn and this one is completely torn, this can drift up, and so now it's a real problem, and the orthopedic surgeon has to get involved to give some stability because this cannot heal because the ligaments are torn. But here you can see that band, this gray, is part of those ligaments, a really clean tear. This should be down here. And that's it. So this is an example of an AC ligament sprain, a grade 3, where the ligaments of both of these are completely torn, and this is unstable, and the clavicle is high riding. And that's it. Thank you so much.